Welcome to Cumberland Conversations. This is a place where we talk about the issues that matter most to you, your patients, and your community. We're diving into real conversations with real people, sharing insights you can actually use. Let's get this conversation started. Hi there, welcome back to Cumberland Conversations. Today we're going to have our first installment of the Practice Management Minute. The Practice Management Minute is going to focus on operational ways that you can help improve your practice and clinic. Today we're going to be discussing the Pediatric Ambulatory Infection Prevention Program from the Monroe Carroll Jr. Children's Hospital at Vanderbilt. And I'm thrilled to be joined by an expert from their department, and I'm going to turn it over to you to introduce yourself and tell a little bit about your program.
Very good. Thank you. And thanks for having me today. My name is Dr. Natalya Beneschott, and I am a pediatric infectious disease physician at Monroe Carroll Children's. And I work specifically in the infection prevention program. And I'm very excited to tell you all about the Pediatric Ambulatory IP or Infection Prevention Program and all the resources that we can provide to really everyone in the kind of Nashville area, if you will. So we are a program that is really available to provide resources to any sort of clinic, ambulatory surgery center, or whatnot to be able to safely navigate any sort of situations where there might be an infectious concern. And so one of the ways that we're able to do that is to provide resources and really talk through not just some of the clinical scenarios, but a lot of the environmental processes where there might be, say, a risk of contamination or potential transmission.
That's great. That's something I'm really passionate about. Coming from previous practice operations and practice management, there was a definite concern around things that we did not see very often as far as infection prevention was concerned. So there would always be a question, do we keep this child in the car? Do we bring him in a back entrance? How long do we let the room sit empty once we've treated them? And COVID really brought up a lot of those concerns, but now we've seen it with other infectious diseases. So I'm really excited to hear about the resources that you all provide and some of the operating procedures that you have or recommendations for guidance for these clinics. So I would love for you to tell me a little bit more about what you could offer some of the clinics.
Yeah, definitely. So as you're referring to, right, we're really seeing a resurgence of a lot of the vaccine preventable childhood infections, such as measles, mumps, pertussis, chickenpox, and whatnot. And so one of the things that we are providing are we're actually doing kind of educational sessions with clinicians and frontline staff on what do these infections look like and how do you safely evaluate that patient. A lot of it is much more than just the patient sitting in front of you and what tests to run or what potential treatment to consider. It's how do you protect your patients who might be in the waiting room?
Mm-hmm.
Those newborns that are there for their, first visit with you. And then particularly, what do you tell that family? Do they need to go into quarantine? When can they go back to daycare or school? And so with the number of measles cases recently, we've been working with a lot of clinics and providing really tailored resources to them, saying, okay, based off the layout of your clinic, how would you bring a patient in? Is there a back entrance? Do you need that patient to be out in the vehicle? Do your patients even arrive by a private vehicle? And then how do you triage them? And for your front desk staff, what do they need to know to be able to appropriately relay any concern to, say, your medical assistant, your nurse, your clinician? And then from there, once that patient is in the room, what sort of room do they need to be in? A lot of our clinics, so we're talking a lot about measles these days. And so given that can be transmitted by airborne droplets, you really want to get a patient into your clinic and into a neutral pressure room as quickly as possible. Ideally, it's a negative pressure room, but those really just aren't available in the ambulatory space.
Correct.
There aren't too many positive pressure rooms, but you definitely don't want a positive pressure because that could potentially transmit it more. So once that patient and family is in a room, you want to be able to know what questions do you need to ask, right? Have they traveled? Has there been a fever? What's the rash looking like if they have one? any known sick contacts, that sort of thing. And then the process of, okay, once that family's in the room, you get photos and then you reach out to our infection prevention program. And what we're able to do is really be a liaison between the Tennessee Department of Health, who ultimately runs the tests, and then with your clinic so that we can help you assess that patient, determine next steps, and hopefully get them out of the clinic as quickly and as safely as possible.
That's a great sense of security to have somebody that you can reach out to. And I know we'll probably get to how they reach out to you to get that information. But I do want to go back real quickly just to some of the triaging process. Do you have any recommendations for like the room and once the patients leave, what you need to do? We already started talking about that, but what should you do once the patients have departed from the room, or what type of PPE do you recommend for the team to wear? So I know that's kind of two different kinds of questions, but just to prepare the clinics a little better.
Yeah, definitely. So in terms of the kind of initial PPE, so you want your patient and their family, because they might have potentially infected family members. You want the patient and family to wear a surgical mask. Okay. And then you want to bring that patient as soon as possible, like I said, in a negative, ideally, or a neutral pressure room. For the clinic and staff, you really want them to wear N95s. Are really your go-to and have those readily accessible. PAPRs are another option, but those usually aren't available in the clinic setting. And then once that patient is evaluated, you want to remember that room needs to be vacant for an entire hour for complete air exchange. And then once the patient is essentially done in that room, what exit can they go out of where they're going to minimize any potential exposures to other staff or other patients? Or a lot of our clinics are kind of within larger buildings. And so they might be walking by other clinics or other businesses or whatnot. And so that's one of the things we've been able to provide is saying, okay, what is the best entrance exit? If it's not feasible to have that patient evaluated in the clinic, how can you safely go out, say, to the car and evaluate this patient while protecting yourself and your staff?
I love that. Yeah, thinking about an exit strategy, we think about the entry, but maybe not the exit, and they just walk right out the waiting room. The one thing I was going to ask is maybe about an air purifier. Again, this came up during the initial year of COVID, and so we would purchase these very high dollar air purifiers to put in rooms to try to process that. Is that something that you might need in your clinic now with potential measles or pertussis or other infectious diseases?
Yeah, so probably referring to more like the HEPA filters.
Yeah, HEPA filters.
The very noisy, large kind of cumbersome filters. And if those are available, that is fantastic. It's another way to try to mitigate any potential exposures. Oftentimes those are not readily accessible. And so we don't want to kind of slow down the rooming of that patient or keep them for a prolonged period if it's not something that is easily accessible. But yes, it's one of the things that, say in the hospital, if we're limited with negative pressure rooms, we will bring in a HEPA filter to essentially try to minimize any potential exposure until we can get into an ideal negative pressure environment.
That's great. That's great. Well, it sounds like you were really doing hands-on and very specific plans for a lot of the clinics here in the Middle Tennessee region. Can you tell me a little bit about how they might be able to get in touch with you to walk through this process?
Yes, definitely. So we're very excited to meet with clinics one-on-one or just kind of be available as a PRN resource. And so probably the easiest way to reach out to us is through email.
Okay.
infectionpreventionists@vumc.org.
Okay.
If you have like a urgent or emergent question, then we ask that you actually page us.
Okay.
And that can be through eStar or just any sort of paging program. And that number is 615-835-1205. Again, if you have a patient in clinic and you're concerned about measles, pertussis, or, potentially, fever, unknown traveler, and you need to talk to somebody right away, paging would be the way to go. If it's more, hey, can you help us out with our process, review, our triage, or help us determine what's the best way to clean this sort of, device or whatnot, then I would say email is usually the best.
Okay.
You can definitely email me directly. I do have kind of a long name. So, but it is Natalya.m.Beneschott@vumc.org. And if you do email the infection preventionists at vumc.org, that will be directed to me right away too. We are really a resource for you and your clinic, and it can be anything from patient-facing concerns, talking about how do we prevent transmission of infections, but then a lot of the sort of environmental cleaning. Can we help at all with facility design and construction? We love to be involved early on.
That's great.
So if you're expanding or moving into a new environment, we can often provide recommendations of, hey, we really need a sink here, or hey, can we take out the carpet in this area? And here's the guideline or the reference to help support that, so that we can really help optimize the workflow. General pediatric clinics are doing so much and the turnover is so high. And so is there anything that we can do to streamline the process?
I love that. And with the grants that we are currently working on with the Tennessee Department of Health to increase access to care in rural and underserved areas, we do have a lot of family practices that are really diving into, full pediatric care and really adding on, some services. We do have some clinics that are expanding, adding additional exam rooms or maybe changing locations to have more space. So that's a really great resource for us to know so we can connect you with them as we are doing some of those walkthroughs and planning. So that's really exciting. I know one thing we wanted to talk about today was the travel clinic, and because we do have so many patients who are traveling abroad to see their families or for different reasons. So do you mind talking more about that?
Yeah, thank you. So we have a new pediatric travel clinic, which is very exciting. My colleague, Dr. Walter Doherty, is running that clinic, and it's something that you can put in a general, peds infectious disease referral, and we can see them. And then if you have a specific question, you can also reach out to Walter directly. It's walter.doherty, DEHORITY @vumc.org. I'm happy to provide that email for you.
Yeah, no, that's great. Yeah, and we will make sure we get those contact, emails or phone numbers out. And we are going to go ahead and talk a little bit more though about travel vaccines. I'm kind of putting you on the spot here, but so does this travel clinic potentially offer travel vaccines as well, or is it okay? That's great to know.
Yes, as you probably are familiar with, it can be quite challenging to get approval for all the travel vaccines, and then just being able to have those readily available for the rare instances where you might need them for your patients. So we do offer most of those. If it is a very unique vaccine or whatnot, we might need to do a little coordination, but Dr. Doherty and our clinic can definitely help facilitate that process too, and also provide a lot of the additional counseling for families so they're not coming back with something that maybe isn't vaccine preventable, but might be preventable from other behavioral behavior or exposures.
Yeah, no, that's great. I know that's something we would have a lot of patients who would travel maybe in the summer to go visit family in other countries. And when they would come back, would need very specific screenings after reentry just for certain diseases, or prior to going would need a vaccination. And, we through the foundation are able to provide some discounts on some of those travel vaccines, but not all of them. And sometimes it's not feasible for the clinics to carry them because they'll go bad before somebody might need those. So that's great to know that you have that benefit as well.
Yeah.
And I do think it's just so needed now for the patient populations that we serve here across the Middle Tennessee region in particular. So that's great to know.
Yeah.
Is there anything else that you would like to share about the ambulatory infection prevention program, or anything we might want to, get out there to our members?
I think of the most severe infections, like I said, especially in your infants and your immunocompromised patients. Those families, if there's a concern, especially with the access to My Health at Vanderbilt, sending a photo, reaching out to your pediatrician or your family doc, whoever, and saying, hey, this is something new. So really just making sure that people are plugged in with their primary care doc. And if there is, something going around that is new or different, that they're aware of kind of the signs and symptoms. There's lots of resources available online, including like healthychildren.org about a lot of these infections. And so I think like in the home, it would be primarily if one child is sick, as much as possible, trying to make it so, they're not maybe sitting next to that child at the dinner table, and, all the hygiene practices that you can do with little ones that
It's very challenging. My two, I have a 5-year-old and almost 2-year-old, and they want to touch nonstop. And one's a 5-year-old boy and a 2-year-old girl, but they both think the other one is the coolest thing. And they all automatically want the toy that the other one has, even though they have, nothing there. So it is a challenge as a parent. I feel like I'm constantly, even with like a stomach bug or, like a cold, I'm like, don't get around each other, don't touch. So I can't imagine some kind of infectious disease being in our household. But I feel like the majority of the time you almost assume that everybody in the household, once you realize that one person's infected, that everybody has been exposed and is infected, and treat it kind of as such and try to mitigate that contact, I feel like.
I think the only other thing is maybe just in terms of, is there anything you can do to prevent sibling transmission? That I might highlight is maybe not sharing drinks and like passies as much, right? Things like that, where it's just so easy for saliva or something else to be transmitted, mucous membranes. So if there's anything feasible, possible, just maintaining those kind of clean products as much as you can. I can't tell you how many times a parent is like, oh, my older one just is, trying to get attention and sticks the passy in their mouth before they stick it in the baby. And you're like, and kids are kids. They're going to do things and you're not going to be able to prevent everything. But we, you do what you can.
I was going to say I wouldn't have classified myself as a germaphobe until I had children myself. And I do not let my children drink after me. I do not let them drink after themselves. I actually scare them sometimes because I'm like, no. So I think that's a great point to bring up, just trying to think of ways, and if they do drop the passy, the mom doesn't, clean it off herself. I've seen people do that and I'm like, oh goodness. So I always just assume that we're all infected with something. Let's not spread it around. So I think that's a great point to bring up.
Well, and like some of the infections, you might not be, say that like young kids or adults might have, you might not be very symptomatic. Right. You can reactivate CMV, cytomegalovirus, or HSV, herpes simplex virus. And for our, babies and our immunocompromised, this can be really serious. But you don't think about that. You just think, oh, my kid is thirsty after playing out on the playground. I only have one water bottle because they finished theirs. So here's, take a sip of mine. Those are just things you don't always think about. And most of the time, it's not going to cause a problem. But we tend to see kids where it's the rare instance or kind of that perfect storm where it did cause a problem or it did cause an infection or there is a concern. And so I think we're all just trying to do the most that we can to protect kids and partner with the people who see the most kids, which are all of our pediatricians and family practice docs.
I think that's great. Yeah, that's a great point for everybody to remember. So, again, thank you so much for joining us today. This information has been fantastic. And thanks. And we look forward to having future topics. If there's something you're interested in, please reach out to cpfnashville@gmail.com. And that way we can get it in queue for our next Practice Management Minute. Thank you and have a great day. Thank you for joining Cumberland Conversations. We're proud to support the people who care for Tennessee's children. Don't forget to subscribe so you never miss an episode, and stay connected with CPF for more tools, trainings, and community updates. Until next time, take care.